Welcome back, everybody. When it comes to the health of our senior citizens, United Healthcare has taken a look at where the state of Louisiana is excelling and where it's falling short. They have just released their annual America's Health Ranking Senior Report, and today, Dr. Philip Painter, the Chief Medical Officer for United Healthcare Medicare Retirement, is joining us virtually to break down this newest report. Dr. Painter, thank you so much for joining us.
Hey, great, Malika, and thanks for having me.
Yeah, thanks so much for coming on. I know a lot of fabulous senior citizens watch this show, so I'm glad we're talking about this. Let's start with this. Where does Louisiana rank this year in this report?
Well, Louisiana ranks 49th, which is the same place they were last year, which I think, Malik, means there's definitely some opportunities for the state to work on the health and well-being of the senior members in Louisiana.
Absolutely. We definitely want to kind of move up, you know, and not stay the same. And at least we're not 50, right? There's the small silver lining in the report. You know, what's interesting about this report is that it actually looks at the strengths and weaknesses for the state, like I mentioned. Let's start with the positives, Doctor. What are some of Louisiana's strengths?
Yeah, I think some of the real strengths for the state of Louisiana are a lot of our seniors there have dedicated healthcare providers. So they've got a primary care physician, someone that they can really work with on their health. I think you also see a low suicide rate in Louisiana, which is a great thing to have, and then lower prevalence of excessive drinking. So those are the real positive factors that you see in the state.
And why do you think we have those as strengths? Do you think it's because we have the resources available?
I think a lot of it is, you know, having those resources available and having that access to a primary care physician. I also think when you see the low suicide rate, just social connectedness and neighborhood are things that help people around keeping that positive kind of mental health attitude that they need day to day.
Absolutely, is so important. Now let's go on the flip side. Let's talk about some of the challenges for the state that were shown in the report. What are some of the challenges?
Yeah, I think one of the real big ones here is physical inactivity. So people need to get up, they need to move, need to get some daily exercise. So I think that's a key point. The other is around what we call food insecurity. So do people have access to good foods, healthy foods on a daily basis? What do they have in their refrigerator? What are they eating? And then lastly, just making sure that cost isn't a real barrier for them when it comes to getting health care from the various types or resources of healthcare that they can have access to.
It's so important. Actually, in the report, everybody, I want to read a statistic to you. The percentage of physical inactivity in seniors rose 29% from 31.5% to 40.5%. So seniors, if you're watching this right now, after today's show, go do a little walk or something. We want to make that number go down. And I'm curious, we're talking about seniors here, right? What age group is that considered? Because depending on who you talk to, some people might say, I'm not a senior citizen.
Yeah, by definition, it's 65 and older, but I agree with you. There are people that definitely don't put themselves in that category around those ages. So
I like to say well-seasoned all the time, you know what I'm saying? And I'm curious, now that you all have this information, Doctor, what does United Healthcare hope to do with this information?
Well, I think what you see in the information can really be used at the state level in kind of a call to action for local government, local social support agencies, and really think about those areas that the state can target to try and improve the health and well-being of their senior members.
It's so important that we take some time to focus on our seniors. Good luck to all my senior citizens watching. You know we love you all. And Dr. Painter, I want to thank you so much for joining us today as well. And look, everybody, if you want to view the full report on senior health at americashealthrankings.com.org is the website. Go to that website if you want to view the full report, I should say. And by the way, if you want more information from United Healthcare, follow them on social media at UHC. Now look,